we go. Including you. Ah.
Oh, she sent the link.
That was in November.
Oh, I see. Like to discuss about herbs, wonderful herbs, yeah. Let's see what is happening.
Okay. I think 1999. He's been more like emotions like stuff. She's a student, yeah. Oh, but I did the aggressive energy. I haven't seen her since then. Yeah, so it'll be interesting to see her do that. And then I'm not better than another friend of mine who's more mostly emotions. So.
Hello. Sorry for my tardiness. Technical difficulties.
Hello? 我也进了，我其实都是那个。
Hello. Hi, sorry, we're just figuring out some things over here. We'll be starting in 1 minute. Alrighty, I'm just gonna close the door. Okay. Hello, everybody. My name's Sophia. I know some of you on here. Some of you I am not sure that I know. Might be some of the other practitioners. Most of the supervisors I do know. And I guess Tora and a couple other people reached out and asked me to teach a short little class on something that I do talk about quite often, which is like patient experience in the clinic and how to make that a really positive experience. And then also on draping, which is, making sure the patient's covered and secure and comfortable. Earlier today, I taught the class for the interns that are in the clinic. So a lot of this is geared more towards, fresh practitioners. I think they just wanted me to go through it with everyone. And I guess it's good for the supervisors just to know what the expectation, I guess, of the interns is from this type of class that they had me put together. So there'll be 2 presentations. The first one is just kind of a quick overview of how like a day might go in the clinic, like a step-by-step type thing, to like from when you first come in, setting up the room, all the way through saying goodbye to the patient, just how that interaction can go more smoothly and positively, and how to deal with like difficult patients, which most of you, I'm sure, have had plenty of in your lifetime. Um, I've been working directly with patients and clients for about almost 20 years now doing massage therapy. I've worked in a lot of medical settings and currently have a small acupuncture business, but a pretty large massage therapy business that I've been running for a long time now, just working with all types of people from all different backgrounds. And so that is where my experience comes in here. So I'm gonna share my screen and just get going, and feel free to just like interrupt me and interject, and if you have like something to add, I would love to hear that as well, because this will probably be recorded and they might save it for future use, or use it to like help shape other classes for students and interns in the future. So feel free to interact and comment wherever you may feel. All right, let me start sharing my screen. Okay. Alrighty. So this is just the beginning to like the what they called in the email they sent you all, clinic etiquette, just how to go through some of these steps to have a great day with your patients. All right, let's get right into it. Simple, go through these 8 steps. So step 1, obviously we want to set ourselves up for success fresh off of the bat. So I guess in a supervisor position, you want to be reminding students to come early to their shift, just so they can get organized, set up their room. As we know, the appearance of a treatment room is really important when you're trying to have a calm environment to bring a patient into. I mentioned with them earlier that when we are starting our day, a lot of us had learned from one of our professors here to put your energy into the room and make it a calm space. So setting your intention for the day in your room, like how you want things to go, whether that's like, let this room be comforting and healing, let this space bring fresh perspective and uplift my clients today, my patients today. um just after you set everything up and before you exit the room, just maybe take a moment and be like, allow this space to be really positive today, because everything around us is so heavy. So really just clearing out a really nice space for a patient to come into and fully relax and feel calm and trust their interaction with you is extremely beneficial. And another important thing is to give yourself time to calm down before you go and get the patient. So take a look in the mirror, look at yourself, make sure you're okay. Take some time to have some water, a breath mint, so you're not breathing coffee, eggs on to people, whatever. Just taking a moment before we're rushing to pick up a patient. That's why I always just tell people, get there earlier than you think, because rushing never feels good to anyone. I mean, we all have done it, especially with kids and family and stuff. Getting places on time in Los Angeles is so challenging, but striving for this is great. And then also to like organize your day, getting organized with your computer or your laptop, having everything set up, pens, papers, etc. So you're not running around while you're in between patients, just so you have everything you need right where you're at already. And then another thing I think is really important is to take like a few minutes to go through the patient's charts that you have for the day, or at least the first few. Um, Nobody likes repeating themselves over and over again, especially if it's someone you haven't seen. It's a new patient or you haven't seen them in a while, and they've been still coming. You just want to like refresh yourself on what's been going on. So you can, when they interact with you, then and you say, "Oh, I see this has been happening for you." It just feels better than being like, "So what's up? How have you been? What's going on?" And they start telling you stuff that's already documented. Um, it's just better if you are refreshed a little. That's why taking good notes is important for other people. If you're sharing patients, really important um, thing to do. Let's continue on. Step 2. Are you guys seeing this little Zoom box or not? Probably not. Okay. Step 2, making the first interaction with your patient meaningful. So after you've set yourself up and your first patient arrives, if it's somebody that, let's say if it's a new patient, okay. Let's say if it's a new patient, of course, that is a little bit more of a meaningful time because this is the first time they're meeting you. You don't know too much about them. So confident handshake, a smile, make sure your appearance is nice. You don't look like you've been rushing around. You look like you're there and you're prepared and ready to give them your time and energy. That can go a long way. Just a glance and a look and a confident handshake and smile can set up the whole next hour for you. Somebody's unmuted, I think. Everyone check if they're muted or not. I can't see right now in my view. Okay.
It's Dr. Chian.
Dr. Tian, can you mute your thing?
Who's in control of the Zoom on Yosan?
你在看我们照片吗？他怎么说？嗯，
在上面有一个情况了，上面我的上3个不能再下来嘛，上出来不简单。
You're not able to mute Sophia. Them.
I'm not.
基本302要看一下。
I'll text Tora.
3字是我们那个
For sure,
传
I
统
think.
咱属于是从302出来的，好像没影响到他。
202抓地抓不到吧？
他好像没对他伤害，好像有吗？也有，他也有。
这也有。他墙是贴了东西，你从里面走也会看不见，外面看不见。
嗯。那怎么地方？
就是呀，现在就
Dr. Tian, can you hear me? Dr. Tian?
就这样，已经是。
Do you want me to text her? Do you want me to
Yeah,
text
sure.
her? Okay.
Maybe.
No.
Oh, can you mute your camera or your Zoom? Dr.
Yes, hi.
Oh, I think somebody got a hold of.
Okay, Tora's gonna do it. Hang on.
Okay, all good. All right, let's go back to this. Okay. So making the first interaction meaningful. Another thing that I really think is sometimes you get a person you're not sure how to pronounce their name. Don't just, if you just go in confidently and say it completely wrong, that's fine, but definitely ask if it's a name you're not quite sure. It goes a long way when someone's like, I really care to know to pronounce your name correctly. Just a small little thing that can make a difference for somebody. If you're running late, of course, acknowledge that with your patient, whether you have to text them, tell the front desk, whatever your situation is. It just is sitting, everyone sat in a doctor's waiting office for a lot longer than they've had to. and at least being acknowledged and, that tells the patient that you care and you're apologetic for running behind. Authentic compliments go a long way. I mean, don't make up just random compliments. That's, not authentic and you're not kind to do as well. But, sometimes if you can tell someone's having a bad day, just sparking up a little conversation by being like, hey, I really like that bag. Where'd you get it? Or is that the new phone you have? Or you have a great smile. Just something to kind of begin the interaction without getting them, when you're walking down the hallway, you don't want to be talking about, what's going on. Oh, my back and this, because we don't want to discuss their health information, but just having a little bit of small talk right off the bat, rather than just walking them down the hallway to doom in the room, can be a little bit more uplifting and help with your connection with your patient. And once they're in the room, also that when you're walking down the hallway, just asking them if they need to use the restroom or would like some water ahead of time before you get them in there just saves time from everyone's day. There's been many times where I was in the student clinic, we get down there and they'd be like, oh, I have to use the restroom. And then you have to walk all the way out to show them where it is. So if you can knock that out right out of the way when they're still in the waiting room, just be like, do you need to use the restroom? Oh yeah, actually I do. Can be save you time. And once they're in the room, you want to help them feel comfortable, show them where they can hang their things, show them where they can place their things. Be like, oh, if I find that it's nice to have like a set of instructions given to you as a patient when you're going into especially a new space and office. It can feel like awkward and you don't know where things go, what to do. Just be like, okay, this is where you can put your purse. If you want to hang your jacket here, our shoes, you can put them under the table or under the chair. Just help them get comfortable already. And that just will allow the next part when you start doing your intake to go smoothly. So they're a little calm, already starting to get towards the calm. Alrighty, taking an intake. So obviously this is geared, again, like I said, towards the students, but this just like some reminders for us that are already practicing or have been practicing. Although it's our job to uncover, find a diagnosis and treat that, it's also our job to be good human, careful, and trust with our patient. So, sometimes people just need to talk for a little bit before they share their whole health history and everything. And that's okay. Just being able to discern that from the beginning is, says my internet's okay. As we know, listening and observation are some of the best skills. So as somebody's, talking with you, we just reminded to really look again at all the things that we already know can tell us stuff, like their face, the structure of their face, if there's redness, if there's discoloration anywhere, look into their eyes, look and like assess their shin. Like sometimes you can get a really good read on somebody just by looking them in the eye and seeing what's there. Um, and also like don't be afraid, like we all know this, but being like able to touch a person, like when you shook their hand, did it feel looking at their skin, does it look like puffy, does like you're looking at their body, do you see swelling at their ankles while they're sitting in the chair telling you things, do you see weird body movements, are they fidgeting a lot, are they holding themselves like sitting like this, tapping their hands? Observing the patient when they're telling you stuff sometimes can be even more valuable than what they actually tell you, especially when you're first getting to know somebody, or even when you've been treating them for a long time. They're like, just do the normal, just come in and do the thing, make me relax. But we always want to be observing and really listening to not just their words, but their body language. So obviously, yep, we need to figure out a diagnosis, but sometimes questioning is not going to work. You have a patient who only wants to talk about their cat a minute. and you don't have that time. If you're on the other side and you see patients every 15 or every 30 minutes, like there's no time for that. So knowing how to direct the conversation and what somebody may need to be able to like give you a little bit of what to work with, and sometimes they won't even be able to give you what to work with, and you're going to have to discern that just by having them lay down on the table, feeling their pulse, checking their tongue, and asking a few questions like, what do you I think when I have difficult patients that I just am not really getting a clear, concise idea of what's going on because either they don't want to share or they're oversharing, I like to ask, if you could feel anything after today's treatment, from today's treatment, what would you like to feel? If there's anything in the world that you could feel after this, what would that be? And sometimes that's enough because that's the chief complaint in an essence is asking them, like it's on the opposite end. What would they like to feel? How would they like to feel? Well, I'd like my shoulder to not hurt anymore. I would like to feel peaceful. I would like to feel energetic, whatever. And then, and then assessing from there and seeing which organ systems like this may be in or whatever way you personally like to treat. But asking that sincere question can sometimes help when you're not able to get your questions answered in a way that you want. And obviously, like we want to focus on the chief complaint, but not in a super insensitive way. So sometimes, when people come in, you're like, okay, what can I help you? Oh, I have shoulder pain. How long have you had it? What's the range of motion? Okay, lay down. That is a great way of, you can get to the point and get treating if you're working in a fast-paced clinic, but also just remembering to throw a little bit of, we're both humans here trying to build a connection and relationship, and I'm trying to have that relationship long term with you because I want you to keep coming back to see me. And yeah, just remembering little important things about them and their lives, building trust is just a really big step in having positive treatment outcomes in general. Alrighty, step 4 is kind of like helping people's like nervous system calm down so they're not wondering about what's going to happen or thinking about what's going to go on in the treatment. This is more for like, I would say, a new patient, not a seasoned veteran of acupuncture. You would just first start by what they need, just telling them what they need to do. Okay, so first I'm going to have you lay face up on this table. You're going to remove your socks and shoes. You can place those here. I will have you actually remove your pants and get undressed from the waist down. Here's a gown. I would like you to cover your bottom portion of yourself and your legs with this. I have the table heater on. Does that feel okay? Just like not like walking them step by step through everything you're doing. So you're removing the stress from them being like, oh, is it okay that I put my shoes there? Because some people overthink and have a lot of anxiety around that stuff. So, oh, if my clothes are on that chair, are they going to need that chair? Or so they're not worrying about anything. They can just relax on the table. And oh yeah, and the step stool, like some people make sure that that's there and be like, you can use the step stool to get up onto the table. Just little things like that that we don't really think about. We're like, okay, just lay down. Some people just, they overthink and they'll have in their mind going like, did I do that right? Once they've laid down, you wash your hands, you come back. Obviously, if they're new to acupuncture, giving them a little brief synopsis of what's going to happen during the treatment is extremely helpful. Explaining what a needle does, how small it is, why we do it, where we're putting it, and why. Like, I found that sometimes we don't need to teach people all about Chinese medicine all the time, but when you get their brain on board with what you're doing physically to their body, it builds this other connection that's just like, they think about it. It's almost like a placebo effect in a way, but there's no placebo. You're actually are putting the needle. Like if you tell them, I'm gonna needle you right here in this point, it's called large intestine 4, and what it does is it really helps direct a lot of my treatment towards your head and neck and work in that way. They're gonna be like, oh, that's cool. And instantly there's like this connection between their brain and this point. So they've made like another connection. So when the needle goes in, there's kind of a double sort of connection happening there from not just the needle, stimulating something, they are thinking about it a little bit. Obviously, we don't want them to be thinking and stressing about all the points the whole time, but just sometimes advising a little bit and giving a description of what you're doing can be really helpful in the treatment outcome. And then just, asking them, like, let's say they really focus on relaxation, trying to make the room as relaxing as possible, dim the lights, ask them about comfort. If someone's like, I don't want to sleep, I have so much to do today, maybe you leave the blinds open, or maybe you do leave a light on if they want, just asking. And I put on here, if you're going to drape them in a specific way to access a certain point, just let them know ahead of time. Let's say, we'll talk about draping later, but like when you're like, oh, okay, so we're actually going to be doing a point that's very high up on your outer thigh. I'm going to be draping you up to that point, but you'll be covered and secure the whole time. Just letting them know. So again, their brain is not thinking about what's going on. You've already told them, so they're not worrying. Step 5 is be confident. So a lot of times we can sense when someone is not confident in what they're doing. There's like a light touch can feel not confident. A limp handshake cannot feel confident. A soft voice or soft spoken a lot of times can feel like the person isn't confident in what they're doing. So when you're working with patients, you don't need to be assertive in a way. You don't need to, be like in charge, but you want to have a confidence about you because it's going to create the trust again. Like, okay, this person knows what they're doing. I trust them needling me. I trust them to be in a, compromised position, laying on this table, like half clothed. I trust them. So, I brought in to this slide with the confidence as well as bringing that into your intake and when you're communicating with them, because if you're being confident and like knowing that you went to school for this amount of years to do this job and you know what you're doing, some people like to tell you what they want done during a treatment. I've had plenty of patients in the clinic do that, like, well, I want my kidneys worked on and I want my shoulder worked on and my liver channel is dying. Like, oh, okay. Sure, we can address that, but have a way, like, know your stuff well enough so you can communicate to a person what you see might be going on and explain to them why you're going to be doing what you're doing if they do have that type of demeanor. Because there are some patients that think, maybe they do know it all. Maybe they are smarter than us, but they're coming to us for a reason, and that's for our expertise. So being confident that you know what you're talking about is important. Also, with the patients that just don't want to share anything, if you can have the confidence enough to explain to them in a way that they understand what you're doing, maybe they will be able to share more. Or tell them why you're asking the questions you're asking. Like, just be like, I see that you're not wanting to talk about this, and that's totally fine. I'm just asking these questions because I'm trying to find the best course of treatment for you. And I totally understand if it's hard to talk about or if you don't want to share, but this is just why I'm asking you a million questions. Just explaining that to them can kind of help. And then again, when, again, with the oversharer or the undersharer, or somebody that just you're like, oh, I don't know, that's not really helping me out. That's where our observation, our tongue and pulse really comes in. And tongue and pulse is great, but I think observing the whole body and touching the meridians and palpating and looking and feeling the skin and really paying attention to all those things that we learned, we kind of forget that sometimes. So just being able to do that. Now, I brought this up a lot with like the interns because, in a student clinic, this isn't as prevalent. But then again, I had two interns in here and they're like, oh, yeah, I had a woman who just wanted to have her breasts out during her treatment because she said she got hot flashes and just wanted to be there laying like that. And I'm like, okay, that is not appropriate. And it's hard to handle patients like that come in. You just want to be like, okay, do whatever you want. But no, if you allow it once, it's just going to happen again. Maybe that person's intention is not to be, anything in any type of way sexual, but it's still like inappropriate and it can make the practitioner feel uncomfortable too. And we don't want to have to feel uncomfortable when we're trying to treat and help a person as best we can. So with that intern, I was just like, you just say confidently, like, actually, we just have everyone stay draped, males and females. We cover the chest just to keep them covered, and that's just what we do here. If you could please do that, I'd really appreciate it. Something as simple as that. If they give you a hard time, that's when you have to take things further and like assert a harder boundary. But stopping it on like from the very beginning is the most important, because if you do not address what people do, if it's inappropriate, they keep pushing and pushing and pushing and seeing how far they can get. One of the other interns says she has a man who just gets undressed and lays there on the table without covering himself. And I was like, absolutely not. The first time that happened, you have to address it and say, she said she was having him again come in today. And I was like, okay, this guy comes into the room, you know his pattern already. What you're going to say is very specific and very clear. You're going to be like, I'm going to come back into the room once you're on the table and you're covered. You have to just provide clear instruction and say, maybe even if it's gotten to the point where he's pushing it a little too far, you just say, I'm not going to come back into the room until you're covered. You knock and say, are you covered, when you knock on the door? I mean, also, if you're having like difficult patients like that, you just explain to them like, these are the standards we have here. It's a professional workplace. We do not expose this area, and this area. We keep those covered. And are you okay with that? If you agree with that, we can continue. I can continue to treat you. If you do not agree with that, I'm sorry, but I'm going to have to give you references for a different practice, but we will not be doing that here anymore. So having in all of my years of massaging, people always ask me, oh, have you had any creepy clients, any inappropriate guys? And I honestly, in working for 18 years, I've had it maybe less than 5 times when someone suggested something or done something inappropriate. And I think it's because I do these steps when I first go into the room, and I have this confidence about me that they don't want to try something. And the ones that do are just real, they have their motive already when they go into this setting. But confidence is super key in protecting yourself and making a safe space for your patient, and not allowing things into your practice that you don't want. Just in the case of like the clinic here, if anything did happen, obviously we go right to the front desk. If there's something that somebody's doing and you're just like, no, I've just had it, this is my limit for the day, I just don't want to deal with it, you don't have to either. Some people can, they can correct a person and continue on. But if you're just like, no, that's not for me, I just don't want this type of thing to deal with, there's nothing wrong with that. And you just tell the front desk and or supervisor. The students would tell the supervisors, and you would have that person talk to, and you would not see them again. And that's totally acceptable and fine. But yeah, I just wanted to bring that up because it is something that happens and with people that are undressing before you try to leave the room. You know, it doesn't personally like whatever, I'm just gonna ignore them and walk out, but it doesn't mean that it should be happening. So I try to, if someone starts doing that, be like, oh, excuse me, can you just wait till I leave to do that? Just tell them straight up. You do not need to sugarcoat anything to make them feel comfortable about that stuff. Just if you set that boundary clearly, can you please wait till I leave the room to undress? And you can say it in a very nice way. It's not going to be rude. Um,
I have a question.
yeah.
So I've run into that before, but sometimes if I say, "Oh, you can just wait 1 second, I'm gonna step out of the room," and then they'll say, "Oh, I don't mind. I'm very like I'm very whatever, you know." So like, what would you say in that situation? Like they think
Yeah,
it's them.
that's what the woman with today, she's like, oh, I don't care. I get hot flashes. I'm hot. I just want to have everything exposed. Just be like, oh, actually, it's for my comfort as well. So
Yeah.
if you could just please wait. And then they'll be like, oh, I'm sorry. Like, it's not about you. It's about me. I
Right.
don't want to see that. So thank you.
Yeah.
And it, like, again, a lot of people don't have like an ill intention when they're doing that. It's just what they do.
Right. Awesome. Thank
Yeah, of course. Okay. Optimizing the time that you have the patient on the table. So again, you did your needling, whatever, you dim the lights, you check their comfort level one more time. Some people are totally like fine laying there for a full 30 minutes. I personally sometimes get really antsy. This is why I've kind of started implementing this. If I am planning on leaving someone for 30 to 40 minutes, I will check back in around 10 to 15 minutes and just double check, do you need like to move your arms? Are you okay? Because I've had that experience where I felt really uncomfortable. Like just too much is moving in my body, maybe from the needles, and it's used to not moving. I don't know. Um, just ask them. You can, if you have like a person that's come many times, just be like, do you want me to just turn this off? Do you want to rest for 30, 40 minutes? And they say yes, fine, totally leave them. But if it's a brand new patient, I would check in after 10 minutes. Just, it's a new experience. Even if they say that they'll be fine, it's always just, I don't think there's anything wrong with checking in. So while the person is laying there, you're going to be getting herbs ready if you need it. If you haven't, like, let's say something came up and you're like, oh, they have this syndrome, take the time to like do a quick search. If you need to learn any more information, take a couple minutes to do some research on that so you can have good documentation of what's going on or what you're doing and why. This is good for your own purpose for next time and for notes, but also if you're sharing patients just for the next person. We want to be nice to our fellow coworkers as well. And so let's say you want to give them herbs, you want to refer them to a chiropractor, you want to tell them these supplements, or you want to discuss this nutrition with them. Start gathering your thoughts on that while they're laying there quickly, because so when they come out, you're not forgetting anything. Like just jotting it down really quick so you can talk about it with them. I always find that if I have a lot that I want to discuss with a person, I'll write an email later that day, but I need to take a quick note so I don't forget anything. And then a lot of you are working on that 15-minute, 30-minute time crunch of a schedule, seeing people that quickly. So obviously it's about prioritizing what needs to be done. Most of the time it'll just be like, okay, have the needles in, need to get the herb order in, and I need to be going to get my next patient. Like that's kind of how the schedule goes. But if you know that you need to do something, like if you need to discuss something with them and you're not going to have the time, just make sure you write a note for yourself so you can email them about it later and communicate. And I talked about this with the interns too, like we weren't really encouraged to email our patients during student clinic, but I really think that it's valuable, especially if someone's taking herbs or if you've discussed a supplement that you want them to try, to check in like 3 to 4 days to see how the herbs are going, or if they've gotten the supplement and started taking it yet. Just to kind of like that consistency is how like we can create change for people. Um, and bombarding them with too many things is not good either, but we'll talk about that as well. So this is all about what I was just talking about. I really find value in the lifestyle education of patients. This is probably just as important as them coming in to get acupuncture and cupping, etc. Treatment outcomes can be improved because if you educate a patient on some things that they can do during their week or what they need to be doing during their week, whether they do it or not, just getting that spark going in their mind. This is the reason they're coming in is due to a lifestyle thing that has made this, whatever is going on in their body happen. Maybe they're just coming in for relaxation, whatever. But educating patients on how to better their lives is just so valuable and going to create even more trust between you. And all of those things do have an effect on treatment outcomes. So we used to in the clinic here have a form that was like a lifestyle or something like that, where it had herbs and you could write notes about that. It had exercises, it had Tai Chi, it had like a section to write something for those each in. And I think that is really valuable. And if you don't have that, sending a follow-up email discussing what you think might be valuable for them in their life is awesome. If you are suggesting herbs, whether you give them to the patient or not, writing down what your suggestion is and how to take it, being very specific, like, okay, 3 spoons 3 times a day before meals. Why? Like, explain why we would want to take it before a meal or after a meal. So they're getting it another layer of understanding into their mind of the importance of taking their herbs. If it doesn't matter, just be like, as long as you take it, I'm happy. Supplement wise, vitamins, minerals, all of that is pretty important and powerful and necessary for some of our patients, and educating them on the type and why and the source that they get it from is also very valuable. Referrals, having like a Rolodex of people that you just know are good at what they do that you can refer patients to is amazing. I have this woman who teaches like structural like Pilates. I have 4 great chiropractors in different parts of the city depending on where people live that I refer to. I have a couple massage therapists that I know that I can refer. I like this primary care physician. I love this dentist who works with joints. I have all these people that I've like interacted with over the years, like on my roster. And I know when you have to just really, when you're present with a patient, what they might benefit from. So they might really benefit from having someone assess, like, okay, we're treating someone for TMJ. What is the underlying cause of their TMJ? Is it stress, or is it like is there a structural thing going on? Like, we aren't really able to tell that so much. So they might need to assess what's going on with their jaw. If they say it's only exacerbated when, they have to deal with certain work schedules, and that's different. But just having a good group for that how to refer to is awesome. Being very clear in your instructions is important, and exercises and stretches. I think we should all just know like a good handful of things that people can do for shoulder pain, what they can do for sciatica, just a few for each of these like physical type orthopedic things, just to know and just be like, hey, start here and see if that can help. Do it 2 times a day at least. I remember one of the supervisors, Dr. Kim, was really good. He'd be like, I want you to stare in the mirror and I want you to push your jaw 30 times, 10 times a day. He would just, he had all these cool things he knew how to do to help like work with the orthopedic and physical stuff. So I think it would be really beneficial for us to just all know quick off the top of our head a few things for the major stuff that we see all the time. And diet and nutrition. I love that book, Healing with Whole Foods. That book is just amazing by Paul Pitchford. All of that information in there about foods for very specific patterns is great. And then just like the overall, these foods for damp, these foods for heat, blah, blah, blah. I find that working with patients and educating patients, you have to just do a small chunk. I could write up a whole book for somebody on what could be a great way to live their life, but no one's going to do that. I mean, there might be some people out there. I for sure know. Otherwise, my life would look very different because I would follow my own advice. But just being able to be like, okay, this week I want you to try and eat a couple cups of black beans throughout your weekly diet, or adding some black sesame seeds and seaweed. That would be great if you can do that. Or how about you try drinking hot tea instead of ice water during lunchtime? Like just one little thing can go a long way. And just if they can do the one thing, obviously prioritize what you think would be the best, like right off the bat. Sometimes I just be like, I need you to take magnesium at night. Just we're going to start with that and see how you feel. Just very simple things, one thing at a time. And obviously be very thorough and clear so people understand what you're talking about. And lastly, ending the appointment with the intention of seeing the patient again. Obviously, we all want to continue to grow our business and have more patients and have them to continue to come. So offering to book the next appointment for the interns, I was like, just tell them your schedule. What's your schedule? What's your availability? And explain the benefits of multiple treatments. I think when we're first meeting with a patient and they come in with shoulder pain, we need to be realistic and be like, okay, in the past, what I've seen is I've worked with people for about 6 to 8 weeks and they've seen improvement. I'm hoping to get you in less pain after this one treatment. That's my intention. But realistically, because this is a chronic condition, I'm thinking that it might take a good amount of treatments to get it to really settle in there. So giving them a realistic expectation of what their treatment plan is, how that can look. You'd be like, I want you to see you 12 times. If you can come in 2 times a week, that would be amazing. And why is the important part. Why should they do it? And be able to explain how acupuncture works. And, unless if it's a chronic condition, explain why chronic conditions take time to resolve themselves. Offer your email for questions, be accessible to patients, within your business hours, whatever that may be, because building the trust and building the relationship is so much of having successful treatments with our patients and making real change for them. So just to review, setting yourself up for success, being organized with your day, making your first interaction meaningful with the patient, building that trust from the first time you meet them, the first handshake, first smile. When you're doing your intake, be thorough and sincere. Remember, we're all humans just trying to do our best here. And, our best might be to not tell you anything about my life, but just using your observation skills, using palpation, using all of the tools we used rather than just the talking sometimes is what's going to make the big difference. being very thorough and explaining step by step to the patient to help calm their nervous system, to help them relax so the treatment can actually even work better. So taking that stress away by explaining what you're going to do, being confident in what you do, being confident in knowing what you know. We all like gone through beyond schooling. Some of us here have so much more experience, tens, decades of experience of working with patients. So having confidence in what you're doing and being able to tell a patient why and how something works just can really affect the outcome of your treatment. And optimizing the time while the patient's in session so you're not running around, you have things organized so you're not stressing yourself out by, you know, piling things on yourself for your end of your shift, trying to get your notes at least documented slightly between patients, just if it's a really short, quick note can be helpful. And I really emphasize spending time on lifestyle education. It's something like I'm actually writing my capstone about this because I care about it so much, like educating people and the importance of that and just how that like we all know our mind, body, spirit are one. That's what Chinese medicine, believes. And by incorporating pieces of that into, a session with a person, like getting their mind on board with what's going on, with what you're doing with their body, and having like spirituality doesn't need to be like at the forefront, but sometimes just teaching a breathing technique or a like little meditation for someone to do, or helping them connect to that portion of themselves in a way. I remember one of my favorite things that um, Dr. Ed Sullivan taught me was this how to make decisions like by trusting myself. And it was to picture a ball and two baskets whenever you had a question like, should I take the 405 or the 101 today home from work? You put the 405 over here, the 101 over here, and you close your eyes and you ask yourself the question and you see where the ball wants to go in your mind. And he's like, and you just trust it. And it was just a very beautiful thing. And it's really shaped my life a lot because it taught me how to trust myself. So again, this is all coming down to like educating our patients and having that relationship with them where you're more than just somebody who puts needles in them or does cupping for them. We're educating them. We're giving them more than just a treatment. We're giving them knowledge, which is just, no one can ever take that away. And then again, ending the appointment with the intention of seeing them again, just, saying, I'm looking forward to seeing you, just to know, so they are like, okay, that was really nice. I'm going to come back. And having an appointment on the books, telling them, let's just book it. And if you need to cancel, you just let me know ahead of time. So this is great that it's just in the back of your mind already that you're coming back. And if you need to cancel or reschedule, no problem. But I just would prefer you have something so it's already like in your mind that you're going to come back. Yeah, so that is all. Does anyone have any questions or comments about this portion of today? No. Okay. We're gonna take a little break and then I'm just gonna go over some draping techniques. So I set my camera up in a position earlier to try and show this in the student meeting, so we can try and do that. If I'm happy to also just go through the slides and not do like a physical demonstration, and if there's anyone that wants to like set up a time where they want to see how something is done, I will totally be happy to do that. But this is kind of just a lot, and for the supervisors, just so what the students have been taught and learning in regards to draping and properly covering people. And then for practitioners, I if you need any like guidance or any questions about this, feel free to reach out to me, but I'm going to demonstrate the best that I can on like the major areas and to get to major locations for specific points. So yeah, we'll be back, let's say maybe like 10 after 2:10. Cool.
Thank you.
Alrighty, hello. Welcome to the second portion of this lovely class. Okay, we're going to talk about draping techniques and draping, why it's important. And obviously, a lot of you have been practicing for quite some time and have it all down and what, you know, how you like to drape. I'm just going to go through what I was taught as a massage therapist, and this is extra thorough because people typically are not wearing anything when I'm working with them doing massage. So this is how to just be very secure in your draping and make it extremely comfortable and provide just like keeping the patient covered so they don't feel like anything is going to fall out anywhere. No air is flowing in. It's very tight and secure. I have a lovely helper today who I'm gonna demonstrate some of the draping on after I go through the slides. So this was very nice of her to stay, Miss Rosa Lynn. All right, so let me pull those up and we'll get started and go through that. Share screen. Okie doke. So, draping. Why does it matter? Patient modesty and privacy. Draping ensures that only the necessary areas are exposed. It helps keep the rest of the body covered, maintaining a sense of dignity for your patient. That's important. Warmth and comfort. So since acupuncture, you know, we're lying there for a long period of time. Yes, we have table heaters. Yes, we have lamps, but keeping as much of the body covered as possible is great too, to help prevent patients from feeling cold and help them relax. Proper draping also facilitates helping us place needles strategically and properly, so you can expose certain areas. Like, let's say you need to work some of the upper leg stomach points. You know, you can do that drape while having the abdomen and the other leg covered, etc. Just being able to use the sheets to your advantage, or a gown. And so it also helps the relax. When someone's draped comfortably and securely, they're more likely to feel relaxed, which is the whole point of a treatment most of the time. So when they can relax comfortably, the effectiveness of the treatment can be increased by reducing muscle tension and calming the nervous system. Also, it just looks professional, and it's you know, keeping all of our standards really high to use clean linens and ensure a really professional and respectful environment. Okay, so setting yourself up for success in draping, these are some of the things I like to have on hand: a flat sheet, gowns, towels. Your table heater is always good just for comfort. Pillows and pillowcases, bolsters, tissues if you use an eye mask and you need that underneath the eye mask so no one is cross-contaminating there. Okay. So we're going to start with a full back draping and what that looks like. As you can see on this little diagram here, this is just for the back. This is not like, I'm not talking about the legs right at this moment. When you're draping the back, we really want to strive to not have the person's gluteal fold exposed. I know that, you know, if we're trying to access the bilaus, you know, UB 31 through 34, that can become tricky, but I'm going to demonstrate a little technique that I've learned later on how to do that. But this is just a drape to have the whole back exposed. I'm going to go through this stuff kind of quickly because I'm hoping you know how to do a lot of this. This is just, again, for the supervisors to know what's expected of the students that they're supervising. So you will take the sheet or gown or whatnot, and you'll fold it down to right above the gluteal fold area, not exposing it, the sacrum area, and you tuck it either side of the hips securely and tightly. When there's a pressure of a sheet or gown, whatever you're using to drape, applied to the skin, it helps a person feel more confident and more comfortable. Like when something is loose on the skin, like if you just take it down and you're not tucking it in, it's doesn't always feel as comfortable because it could blow away. There's air coming through. So tucking it does provide extra comfort. Patient. Okay, my glute draping is very complicated to explain. This is what it kind of looks like. I've tried to make a nice little diagram of it, but okay. So when we're doing the glute, what we have here, and we're just trying to expose like half of the glute here. You can always roll this side in if you need to get more like UB line. That is accessible as well. But just for this glute, like if you're doing like 29, 30, if you're not doing it side lying, or some of the other lower UB points are around the sacrum, you can use this. You can even pull this down lower to get into some osher stuff on the hip or whatever you may need. So what you can do, you'll start with a full back drape, you'll fold the sheet down, and you're going to hold it right here where my cursor is. Then you are going with one hand. With the other hand, you're going to take the part which is folded up here, and you're going to fold it down at and make this nice creased angle, and you can tuck it under here, and you'll have your hand here still. There will be extra fabric from you folding the sheet down in this area. You can hold here and pull that fabric up to cover the other side of the back if you don't need it, to just keep the patient as warm as possible. If you're doing back points, you will just leave it down, and you can do this draping on both sides at the same time to create kind of a triangle here. That is possible as well. I will talk about also, if you're going to be doing the legs, how you will drape the legs as well when working on the glutes. Okay, this is fun. So let's say you need both of the legs up to, even up to UB 36, or you want UB 40, or you need any of these upper legs on the posterior side points. What you can do is you're going to have your full sheet here. It's going to be covered. You will be holding right about here and take the corner of the sheet and tucking it, bringing it up to uncover up to the area that you're going to need. So you're going to take the side of the sheet and bring that up onto the leg and make a line where you would like it to go. Then with your arm, you're going to reach in between their knee and lift up from the inside, outside hand, wrap and pull it around the leg. This is so hard to explain just talking, as we did it earlier and I was like, I just got to show you. But if you kind of have an understanding, we're wrapping the sheet tightly around the leg so that it's so secure that if they move, if they do anything, nothing is going to come out. There's no way that it's just going to undo itself. We're getting it really tight and secure. And that way you can do this to both legs at the same time. That would be, it looks like a diaper on the person is what it ends up looking like. And Rosa's gonna let me demonstrate that on her later. So the anterior leg is very similar. What I like about doing this draping on this side is it even allows you access up to the ASIS. You can even drape tightly and then open this up so you have around the hip and the psoas even to get in there, and all of this can be accessed. Again, you will pull the outside of this sheet up at a diagonal to make where you want it to be. and you will take one hand, lift their leg, the opposite hand, wrap it. You're going to wrap the sheet around, pull it very tight through. So then this is wrapped around here, and you have extra fabric here, extra fabric underneath. And you can do this to one side, you can do this to sides. This is, you will most likely have the abdomen covered during this. If you need the abdomen undraped, of course, we'll talk about chest draping and having the abdomen exposed as well. You know, again, we could just lift the sheet up to the area we need, but that doesn't provide security. And it for some people, it just can feel a little unless there's like a heavier blanket. So what the draping provides is that like pressure of like what a blanket might feel like. It's like a tension against the skin. So you do feel secure and covered. Okay. Chest and arm draping. Something that I think is important is do not assume just because a person doesn't have breasts that they wish to have their nipples exposed. Like if you're working with male patients and you just like undrape their abdomen, a lot of them will be fine with it, but it's almost better to just err on the side of caution and cover their upper chest. You could just say you're doing it to keep them warm or for their comfort if they're like, why are you covering my chest? I just recommend doing that for every patient because you never know. And so let's say that you're going to do a chest drape and both of their hands are underneath the sheet or the gown and they're laying there, you know, not wearing a top or a bra, and you have them underneath the sheet. What you'll do is you'll tap their arm and say, I'm going to move this arm to drape your chest. You'll lift it to the side first, pull the sheet or pillowcase, whatever you're using, tightly under the armpit, and then bring it up and down over the top so it's very secure. If you need to access like a heart 1 point or something like that, you can keep it tight, but you'll tuck it under their body and then you'll bring the arm up, but the sheet will be tucked under their body. So again, nothing can move and it's providing that tension there. So you can access the armpit. Let's say you need to get to like spleen 21 or these upper, if you want to get into this upper ribs on the side here, you can still drape and tuck it under, but you would tuck it up a little higher, not under their side body, but you would tuck it up under the back of their arm here and then pull it like on women. If they have breasts, you would kind of like try and pull it around and underneath the breast to secure it. If it's a male, you can just fold it over. And I'll demonstrate this again. This is just, you know, again, we're just trying to make everything tight and secure overall. So abdominal draping, the chest draping goes into the abdominal draping because you'll be doing typically a chest drape first, even if someone's wearing a bra, you know, it just, I would just recommend covering them anyways. They can just stay warm. Most people, like, even if it's just like a sports bra or short tank top, it might be fine, but why not have a little bit of extra warmth? You're laying there exposed on a table, so nothing wrong with that. When you are doing the abdomen, the sheet typically will be covered up to here first. Then we'll apply a towel or a pillowcase or something over the chest, and you'll slowly tug on the abdomen, like to uncover the abdomen from the underneath sheet, slowly tugging until it just clears the top drape of the chest. And then you can fold it down to the area you need and tuck it firmly under each one of their sides. You don't just want to fold it down and leave it. Even if they have underwear on, it just feels a lot more comfortable if you tuck it underneath each of the sides. You can, especially if you're using any oils or anything, this goes for if they're prone or supine, tucking it into the pants or underwear if they are wearing them, just to protect the fabric from being ruined from baby oil, whatever oil you might use. That's fine too. If you can just tuck it into the sides without having to tuck it into the underwear, I would, because we just want to avoid having to touch a person's underwear like that if you don't need to tuck it in. If you can get away with having it firmly tucked under each of their hips, that's great. Sideline draping is probably the most complicated type of draping. So we have different reasons why we might lay someone on their side. Majority of the time, it's to access the side body, like to work on someone's GB30 or whatnot. But if someone's pregnant, we may also lay them on their side. So draping will be different depending on the situation. For the I'm just going to go over like the most common one that people use is for GB30. What I like to do is have people first start by laying on their back, and we'll do an anterior leg drape. So we're wrapping the leg very tight, but we're getting extra fabric, and we're holding that fabric, like, see all this fabric here? If they were to lay on their back, this would be underneath them. So we're holding the fabric, and then we're having them turn while we have that fabric there, and we can keep everything covered and everything's tucked in, and then have them turn onto their side. That's just a really secure way of doing it. If they are laying on their side already, involves a lot more wrapping and using maybe an extra gown or extra towel, which I will demonstrate as well. For pregnant clients, you know, we want to support the neck. Having like a rolled up towel like this is nice. A pillow is fine, but just trying to get it where like we can have a most like parallel spine, so we can get not having it too jacked up or too low, just to make them comfortable. Sometimes having something in front of them, like a pillow to like hold their arm on, is very comfortable. For this top leg here, I usually don't put a pillow between the legs. What I like to do is have a bolster right on this edge, and I tuck mine underneath the table heater to keep it secure. So as I turn them, I put their leg on top of where the bolster is, and then this bottom leg is straight underneath. And it's really comfortable. And oh, this is just a random thing I threw in there. Covering hair, if you're doing cupping on the back, sometimes people have like a lot of hair and they don't have a hair tie. What you can do is you can take a pillowcase or a hand towel that about that size, and you're going to pull all their hair towards you, away from their back, cover with the pillowcase, and begin tucking it into where the headrest hole is on either side their ears are, just to secure the hair from falling down or getting out if they don't have a hair tie. You could also try, if you have a lot of hair, you know how this works. You pull the hair into a ponytail, you're twisting it, and then I like to tuck the hair into the top of the headrest hole to secure the bun, in a way, to keep the hair out of the way. When we tuck our hair behind our ears face up, you can almost do the same thing when someone's face down, just like kind of reverse. So that's a great way to also keep hair out of the way. And again, just to go over some of this, confident movements, you know, light touch does not feel so confident. Like heavily placing a hand on somebody and communicating what you're doing first is very important. You know, placing your hand on their sacrum, being like, okay, I'm going to undrape your glute now to access this one point. Is that okay with you? Sometimes if they have underwear that is in the way, you can lower that and tuck it into the sheet as well, or tuck the sheet into the underwear if you need to access a point and they've kept them on. You just have to explain what you're doing before you do it. Just be like, is it okay if I undrape your glute and tuck this sheet into your underwear so I can access this hip area? just kind of walking them through what you're doing and keeping like a firm contact with their body while they're doing it. The tighter, the better. Less airflow in there. Just keep everything secure. We want to keep people as covered as possible so they can stay warm and cozy. I mean, if it's 1,000 degrees outside, maybe not, but general draping is good. I've come across situations, especially in the student clinic, where we run out of gowns and towels and everything. Let's say you're in a predicament and you don't have anything, you can utilize people's shirts. Like if you want to have their whole abdomen out, you say, hey, would you mind just placing your shirt over your chest while I step out? That can help. You can use their sweaters, sweatshirts, all those different things. And again, practice makes perfect. So obviously you all have been practicing for a long time. This is just a little refresher and just maybe some different techniques than what you've seen. And for the supervisors, this is just what we taught to some of the interns today to practice and try, just so you know what they're doing, or if they ask you questions about it, you know what they're talking about. So I'm gonna set up my little situation real quick. So give me just like 2 minutes and go take a little break, and I'll be back at 2:35. Okie dokie. Hello, welcome to the demonstration portion of this presentation. Okay, so we have our lovely patient here. I'm going to pull up my slides just so I don't forget anything. Okay, so another little thing, let's say I want to show you guys the back draping first. Another thing, when you're flipping a patient on the table and you do, let's say, I'm just going to use a sheet. A lot of times we just use gowns, but I'll show some things with gowns as well. When we use a sheet, so they aren't taking the whole thing with them when they flip, what you can do is you pin the sheet against the table with your body. So one side of it is very secure. Let me remove your bolster first. You pin it with your thigh against the table. You'll hold this up. I mean, generally she'll be covered up to her chest. You'll pin it, you'll hold it up, and you'll have them flip. And then the sheet doesn't go anywhere because you're holding it. You can put your arms up. Okay. So I'm going to put the bolster under her ankles for a full back drape. Again, putting a hand here before you go about what you're going to do, and just say, I'm going to undrape your back right now. I'm going to tuck it into your hips. Look down to the side. How we were taught to tuck is without turning your fingers upwards, because that can feel a little bit grabby. So if you're going to tuck, you can pull it tight and you use your fingers face down into the table. So there's nothing like you're reaching up and touching the person, just a little tip. We'll go around to the other side and also tightly secure it. So they feel like they're in a mini skirt, really tight, 2 sizes too small. It's great. This is just great for if you want to do the back, etc. Now, I'll come around this side. If you want to do just the glutes, and you're keeping the legs covered, so we're just gonna do like from the hips upward, what I do, like I described earlier, you place your hand right here in the center line, and you're gonna fold the sheet back 45-degree angle to expose the side of the glute and the hip here. You can tuck this under at the knee point, and if you're not having too much going on the back, or even if you are, you can grab this other side of the sheet that's left here, if you just need this side of the body, and pull it up to cover this other. So this is like just to get a full like side of one body, one side of the body. You can also, if you do need both sides, you can repeat this on the other side to make a sort of like triangle. You'll hold center here, fold it like that, and tuck it under the knee. Then you have access to both sides of the glute and the whole back. Some of the points that are hard to keep people covered for are usually 31 to 34, and in that region close to the sacrum. What I like to do first is I will do the posterior leg drape. So what I was talking about, you have this side of the sheet here, the edge. You're gonna bring up this is the very corner. You're gonna bring it on a diagonal. You're not gonna like do this, but it's sticking to her clothes. What you can do is you slide it up. The corners here. You're making a diagonal on their leg where you want it. With your arm, you face their head with the arm that's closest to the leg. You're gonna reach in between, like under their knee, and support their knee. If you just grab their foot and try and do it, it's not gonna work. If you just like lift the shin, it's not gonna work. So you need to support the knee, otherwise the leg is gonna bend. Support the knee, you have like full control of the leg. You're gonna reach under, grab the sheet, pull it tight, like secure. Nothing's going anywhere there. Then you can pull this up as high as you may need. So sometimes we don't need that high, you can just keep it lower, but then you have access to this part of the leg. Nothing is flowing in between her legs or up into her glutes, it just feels secure and comfortable. You can tuck this under the hip here to make a nice, really nice tight drape like that. Let's say you need to access the glutes as well. What you can do then, you can pull this down, secure here. We're gonna fold back this drape. Now, this is like the most minimal amount of draping you probably will ever do, but we do need to access those points sometimes. So you will just roll this inward. We have this blocking this portion here, and you can roll this inward. You can take another towel if it's not staying and put it on top here to secure it, but then you can get very close and get into these UV points that are there. You can do it, have it on both sides at one time. Again, you would do the posterior leg drape where you make a diagonal, reach under, pull very tight, pull it up, and you will roll the sheet to make a thong-like drape. So then everything is secured in the center, like nothing is feeling like it's coming up this way, but we do have access to be able to like move the sheet a little, needle those points, move the sheet a little, needle those points. If you use a gown, there will be a lot less fabric, which is kind of better for this type of draping if you're trying to access both sides of the sacrum at the same time. Again, when you're done, after you've removed all the needles, you want to undrape the person. You don't want to leave them wrapped up as a in a diaper, pretzel, whatever you want to call it, because that would be awkward and really uncomfortable to get out of. Okay, so that's for the back. I'm going to remove this bolster. Thank you. All right, gonna pin the side of here and have you flip on over. Thank you, Rosa.
I feel like I have so much dignity.
You do have so much dignity. You're covered. Okay. So, again, bolster underneath. Let's start with the anterior leg draping. It's similar to the posterior. Grab the sheet, pull it up on a diagonal, how far you need to go up. Maybe you only need spleen 10, and you can keep it low. Maybe you need stomach 32 and 31, whatever. See how high you need to go. Hand under the knee. Pretend you're sleeping. Pull this with the opposite hand tightly underneath. Tight, tight, tight. This is tight too. Nothing is gonna go anywhere. What's cool about this then is you can have access to get up higher because everything is tight and covered if you need it. You can repeat this on both sides. So you again have like a diaper to access both legs. If you need, for the chest and up, let's say you're doing all these stomach and these spleen points, and then you want to hit the abdomen as well. You would take a smaller towel or a pillowcase, and you can cover their chest area with that. If you want to undrape the abdomen, what you'll do is you'll hold the top of this chest drape and slowly wiggle the sheet out from underneath. Sometimes they like to stick together. You just want to make sure you're not taking it with. Get this one a little bit out of the way. Like I said with the chest, move the arm out to the side, then up, and tuck that sheet under so it's very tight up into the armpit. Pull it out. very tight there. As far as the abdomen goes, we'll drape down to where we need. If I need run 2 and 3, I'm just gonna let them know how far down I need to go. You know, we always talked about like having them show you where your pubic symphysis is or feeling with the side of your hand, but always telling them what you're doing. And then I'm gonna tuck in on the sides of the body with the hands face down, so I'm not grabbing underneath them at all. I'm just pushing into the table very tightly. Here we have great access. We have this whole thing. We can also, let's say you need to get some ossuary points in the hip or whatnot, maybe even some GB points in here. We can pull this out, fold this over. It's not going to be as tight on top, but it does feel very secure. Do you feel secure?
Yes.
Great. So you have access to this whole side of the body there. We'll remove this draping, lifting the leg, slowly pulling it out from underneath the leg first, then lower it down so nothing comes out while you're undoing the drape as well. Cover. For the arm, if you need to access into the armpit, you'll have this and you will tuck it, grabbing your sweatshirt, underneath their body, fingers down into the into the table, and have them relax their arm like that. If you need to access these side points, what you can do is tuck this up higher into under their arm and just kind of keep it draped underneath the breast here so you can have access to the side. Alrighty, and to remove the chest drape, I cover them with the whole sheet first and then tell them I'm going to remove it and pull it out like so. That, I believe, is everything. Yeah. Anyone have any questions or anything? No? Okay, great.
Yeah, that was really helpful. Thank you.
You're welcome. Again, if anyone has any questions, they can reach out to me via email. If you want to see any types of other draping, just let me know. I do think this will be recorded, so you can always rewatch if you need, but I'm sure you guys all know what you're doing. Alrighty, have a great day. Bye, everybody.
Thanks, Sophia.
You're welcome.